Okay, good afternoon, everyone. My name is Claire Lazar. I'm the clinical director at VMRC, and we have this COVID-19 info session in order to help our consumers, families, communities, circle of support to give you like a good information about the COVID-19 vaccine that we have now. We have the Q&A button there. If you guys have questions, we'll definitely want to address that. And then this webinar is being recorded and will be posted in our VMRC website under the events tab. And then there will be a drop down that says clinical. And when you click that, it'll be there. I'm hoping within this week. So you guys can go back to it if you guys have questions, or and the PowerPoint as well to go through the links. I just wanted to remind everyone, a lot of things are changing with regards to COVID and the vaccination. So there might be things that have been updated a few days after this webinar have been given. And so you just gotta watch out for those things that have been updated. I usually use CDC links in this, and they do update their site as well. So later we'll have a Q&A portion for this, and then this is set up as a webinar type. So normally if it's webinar, you won't be able to see your video, you won't be able to speak, but you can utilize the Q&A portion here. Later I'll have like a poll that you can give an answer. It's going to be anonymous, just to encourage participation. And you can send your answers there, and we'll just get the answers from there, and it will be anonymous. All right, so to start off, I wanted to clarify the meaning of SARS-CoV-2. You're probably hearing SARS-CoV-2, coronavirus, COVID-19, so those different words, but what are they really? So to clarify, SARS-CoV-2 is the name of the virus that's causing the disease. It came from the family of viruses called coronavirus. So they're like a big family of viruses. And the disease that SARS-CoV-2 is causing is called COVID-19. So that's the clarification to that. So when you get infected with the virus is SARS-CoV-2, and you get the disease is COVID-19. Usually it spreads through that droplets, tiny particles that come out of us through when we sneeze or cough or talk or sing. That's why it is good for us to wear masks to protect us and to protect also other people from those droplet infection. This one, I included this link. It's a very good, it's like an animated video on how this virus spreads through our body and cause and wreak havoc in our immune system. But I'm not going to show it right now in the interest of time, because I want to focus more on the vaccine later. But the link is here, so you can check it out and watch it at your own leisure. This is a link from, no, not the link. This is a list, and the link is here below, from CDC with regards to those that are high risk for severe COVID-19. The latest update to this is Down syndrome. So individuals with Down syndrome are added in this one. It means that those that have any of these conditions are high risk for developing severe COVID-19. And as we all know, the outcome of that, of severe COVID-19, could be death. This list from CDC is those that they call might be at high risk for severe COVID-19. So it does include the other illnesses here, chronic diseases, asthma, cerebrovascular high blood pressure, overweight, type 1 diabetes. I wanted to share this study because this one is showing that people with developmental disorders and intellectual disorders and related conditions are at high risk for dying of COVID-19. So they're about, if you average 3.06 and 2.75, they're about 3 times at risk of dying from COVID-19. While this study is showing that people with Down syndrome are 10 times at risk of dying from COVID-19 and 4 times at risk of getting hospitalized due to COVID-19 related illnesses. And that is after adjustment for heart and lung problems and residences. And I'm thinking this might be one of the reasons why now Down syndrome is included in that high risk of COVID-19, severe COVID-19. So let's go to the bottom of it. The COVID vaccine has been approved. So what do we want to do now? What do I do next? The vaccines so far in the United States, we have 2 that has been approved through the emergency use authorization. On December 10th, the Pfizer and BioNTech vaccine was approved, and on the 17th of December, it was the Moderna vaccine. Currently, most states are under phase 1A of the vaccine distribution, which is for healthcare workers and long-term care facility residents and staff. Dr. Fauci, one of his recent interviews, well, this one says likely summer and fall, but his most recent one, he's saying most likely fall or mid-fall, that the general population will be vaccinated and will get back to the previous normal. So what do we do next now that we have the vaccine here in our community? We want to be able to decide on our own and be adequately informed if we really want to get the vaccine or not. And to do that, we want to read materials, listen, watch information about the vaccine from reliable sources. And what are those reliable sources? It's usually from number 1, CDC, as I have mentioned already. It's the Center for Disease Control and Prevention. And you can also use the FDA, the US Food and Drug Administration. Those are very reliable sources, which I usually get my sources as well. And then other journals, if you will be able to see them. BMJ is the British Medical Journal. JAMA is the Journal of American Medical Association. NIH is a good link as well. They have a lot of different studies there at the National Institutes of Health, or NIH. So those information that come from those sources are very reliable. Make sure you discuss it with your primary care provider. So if you're having doubts on getting the vaccine, or if you have any questions, the one person you could really discuss it more is your primary care provider, because they know your health conditions, they know your medical history, so they will be able to go through this with you and problem solve with you, so you both will be able to arrive at a decision as a team. With regards to pharmacies, Walgreens and CVS will eventually offer it to the general public, but right now they are working with the government through that CVS Walgreens Pharmacy Partnership Program, wherein they are going to the long-term care facilities and vaccinating the residents and the staff of those long-term care facilities. So we always ask, is it safe for me? The vaccine is generally safe. Pfizer has been approved for 16 years and older. It was tested on individuals with obesity, diabetes, and lung problems. It has not been tested on children, nor with pregnant individuals. So children definitely cannot receive that if they're less than 16 years. If you're pregnant or planning to get pregnant, this is something you want to discuss with your doctor, with your obstetrician. Side effects would be, these are the usual side effects: mild fever, muscle ache, fatigue, injection site reactions. There have been cases of a severe allergic reaction, so CDC has updated their guidance on this. With regards to, This is a Pfizer fact sheet from FDA. So see how this website where I got it from, see there's fda.gov. So usually websites that has a .gov in it are reliable sources as well. This is a 6-page document. I just captured the first 3. Part of the CDC guidance with regards to allergic reaction is they wanted you to look at the ingredients of the vaccine and make sure that you don't have any allergies to any of their ingredients. So in this document, it's in here. What are the ingredients in the Pfizer BioNTech COVID-19 vaccine? And they enumerated it here. So if you have any allergies to these components, you would want to discuss that first with your primary care provider. With regards to Moderna, it has been approved for those that are 18 years and older and has been tested on individuals with lung disease, heart disease, obesity, liver problems, and HIV infection. It has not been tested on children, and the same thing, not been tested on pregnant individuals. Side effects are pretty much similar to the Pfizer one. Chills, tiredness, headache, injection site reactions such as pain, swelling, and redness, and the same allergic reaction warning from the CDC. Similarly, they have FDA have this fact sheet for Moderna. So again, these are several pages of fact sheet that I just captured the first 3. And it also has the ingredients here. Here, it's in this part. What are the ingredients in the Moderna COVID-19 vaccine? So you want to look again at the ingredients of Moderna vaccine if you are going to receive that. I suggest you look at both, because generally when you are going to get the vaccine, you don't really know what they're going to give you, whether it's Pfizer or Moderna. It depends on what they have right that time that they're going to give you the vaccine. So it's good to check out both ingredients and make sure that you don't have allergies to any of their components or ingredients. Before I proceed with this COVID-19 vaccines, I think we've started maybe about 13 minutes already. So I wanted to get a pulse and get a poll here. I'm gonna send you out a poll. Just wanted to know which group most of the attendees belong. Are you a consumer? Are you a parent? Are you a family member, like a sibling or a cousin? Are you a vendor or provider? Are you a community advocate or a stakeholder? And you just pick one. It's gonna appear now in your site. So you just pick one, and I won't know who you are and who's answering which. It's just gonna show me numbers of people that are voting. So don't worry, don't be shy, because I won't know who you are, who's the one that's voting. It's just a nice way to gauge the audience that we have here right now. Okay, so about 86% of you have voted. So I'm gonna be ending the poll. So our result, we have, I think I can share the result here. I hope you are seeing this. So we have no consumer that are on this webinar right now. We have about 11 or 42% parent, 4% is family member, 38% vendor provider, 15% community stakeholder or advocate. So that's a good number. Okay. Going back to our PowerPoint here. So remember I told you about that allergy guidance from CDC. So this is part of that. And again, here is a link. They have .gov. So a reminder, if anything with .gov, it's a good way to know it's a reliable source. So this is from CDC, the Centers of Disease Control and Prevention. So they included here, if you have any immunocompromised condition, if you are pregnant or if you are breastfeeding, should you receive the vaccine? They said you may proceed with vaccination. And additional information is provided, meaning you want to discuss this with your doctor, with your provider. And when you get the vaccine, you want to have the 15-minute observation. If you have currently, you're having moderate or severe acute illness, if you're going to receive the vaccination, you want to proceed with caution. You want to do a risk assessment first with your provider. You could defer that, meaning you could take it at a later time and not do it right now when you're having severe illness or a moderate illness. Or if you proceed, you could have like a 15-minute observation period. Another update to that is this one. If you have any history of allergies that are unrelated to components of the COVID vaccine, other vaccines, injectable therapies, or polysorbate. Polysorbate is one of the ingredients of the vaccines, like allergy to medication, history of food or pet allergy. You can take the vaccine, but you want to have a 30-minute observation period, especially if you have had like a severe allergic reaction or anaphylactic reaction before because of all these other allergies that you have. If you had a history of immediate allergic reaction to the vaccine or any injectable therapy, other vaccines, again, you could also do a risk assessment first with your provider or defer it at a later time. Consult with an allergist or an immunologist, or you could do a 30-minute observation period. Now, what are the really contraindicated to that? The red one is the contraindication, that who shouldn't receive the vaccine. That is if you have severe allergic reaction after a previous dose of the vaccine or any of its components, or a immediate allergic reaction to any severity to a previous dose of the vaccine or any of its component. If you have any of that, don't get the second dose, and you should be going to an allergist, immunologist for referral or consultation. So basically looking at this, the real contraindication that they are saying that shouldn't get the vaccine are those that have had severe allergic reaction or immediate allergic reaction to a previous dose of the mRNA COVID vaccine. Now, if ever you're going to receive the vaccine, how long will this protect you? So right now, we really don't know how long it will protect us. They are still studying that. As you all know, this is the first time we've had COVID ever. And so scientists are studying how long the vaccines will protect us. What they do know is that it will provide better immunity and protection compared to getting sick of the virus. If you have been sick with COVID-19, the CDC recommendation is to wait up to 90 days before you get the vaccine. Although I always say to consult with your primary care provider, because there have been other providers that have advised their patients to take the vaccine even if they are within that 90-day period. The reason for that is because there have been cases that the immunity that's supposed to last for 90 days have been going down even before the 90 days is over. So they want their patients to be protected. So that's why they're advising their patients to get the vaccine, even if they're within that 90-day period. The vaccine will definitely provide, as I mentioned, longer and stronger protection to individuals. So it is definitely recommended for those that have been COVID-19 positive to get it. And whether it is 90 days or after that or within that, you discuss that with your primary care provider. So we'll deal more with this. Usually the first dose, you usually get about 50% protection. And after the second dose, you get up to about 95% protection from getting COVID-19. And I'm going to give you the details of that. This is the one that I was mentioning. So for Pfizer vaccine, the study showed that you get about 52% protection after the first dose and about 95% protection after the second dose. So this 52% usually happens about 2 weeks after the first dose, and the 95% protection is about 2 weeks after the second dose. So all in all, from the first dose, you'll get about 5 to 6 weeks of before you get full protection from the COVID-19, from getting sick of COVID-19. For Moderna, after the first dose, you get about 80.2% protection and 94.1% protection after the second dose. And these are the sources where I got all these things. If you want to read it more and learn more information, you're going to be free to click those when we post the PowerPoint. I wanted to emphasize this, that protection from the vaccine is not immediate. Vaccine is a 2-dose series, and it will take 1 to 2 weeks following the second dose to be considered fully vaccinated. If you got the Pfizer vaccine, the interval from the first to the second dose is 21 days. If you got Moderna vaccine, it's 28 days interval between the first dose and the second dose. In between that interval, you could get sick. That's why I am emphasizing this because, for example, if you get the vaccine now and then 2 days after you got sick of COVID-19, you cannot say that the vaccine doesn't work because it has only been 2 days since you got the vaccine. And you might have been exposed prior to, that's why you're getting sick of the virus right now. So those are just kind of like simple things that I wanted to emphasize. I guess it's simple, it's not the word, practical things that I wanted to emphasize to people. So the easier way to remember that is either you get the full immunity 2 weeks after your second dose or 6 weeks after your first dose. This one is one of the latest in the news right now, that California has a new COVID strain, this L452R. We've heard about that B117 strain from UK. There's another strain, a stronger one from South Africa, I think. Those ones they said were more contagious, meaning it spreads faster. This one is pretty new that they have noticed, the experts noticed that is here in California, mostly in Southern California and a few in the Bay Area. We don't know yet if it is here in Northern California. They're continuously monitoring it. They're also trying to see if, is this more contagious? Is this more infectious or not? Is it the same? First question that comes to our mind also is, will the vaccines be effective against this? The experts in the vaccine world are saying they're thinking that our vaccines right now are going to be effective against this new strain of COVID-19, just because there hasn't been much mutation that has happened. Coronaviruses are known for mutating in order to thrive in the environment. So they're thinking that our vaccines could still be effective against this new virus strain. Also, we have had vaccine clinics that have held their vaccination so far. One of them is Stanislaus County. It's because of this Moderna lot 041L20A. This vaccine has been given in Southern California, and they have observed about 10 individuals that has gotten allergic reaction to this. And because of that, they are investigating this vaccine. CDC, Moderna, CDPH, that's California Department of Public Health. They're all investigating this lot number of the Moderna vaccine as of now. So when you get the vaccine, do you still need to wear a mask? So yes, definitely. And the reason for that is because they haven't really been studied if getting the vaccine will prevent you from transmitting or spreading the virus to other people. They're thinking that the experts are thinking you could get the vaccine and still have asymptomatic infection, meaning you are infected with the virus, you have the virus in your body, you just are not sick and you're not feeling any symptoms. About 56% of the community spread, according to one study from JAMA, is from asymptomatic infection. So because of that, we want to prevent the spread. We still want to wear masks and all the safety precautions that we have been doing right now. When you get the vaccine, they give you information on this V-Safe. So it's a nice tool. There's like a QR code that you can scan with your smartphone, and then you enter your information. And then they actually text you. I registered to this when I got my vaccine while I was waiting, and they texted me every day, even until yesterday. I still got a text, and they're asking for your symptoms. It's a quick checklist. You check whatever you have there. If none, you just check none. The good thing about this is whatever you put in there, it goes directly to CDC. And they gather those data, and it helps them in monitoring this vaccine. And then those people that are providing vaccines, they also report adverse reactions to this VAERS. This is what you call VAERS, VAERS. So this VAERS is under the Health and Human Services and also through CDC. And so before I go to what we have done so far in VMRC with regards to vaccination, I wanted to do another poll. Don't worry, this is going to be our last poll. I just did two. And this one is just wanted to know so far, based on what you have learned so far, how many of you are planning on getting the vaccine when it's available to you? So it's going to be the same thing. You can answer it. I won't see who's answering, and it's anonymous, so I won't know who answered which one. It's just a nice poll to feel the pulse of the people that are attending. Okay, so I have about 90% of the attendees voted, and so I'm going to be ending the poll now. Okay, oh, 93%. Now I'm going to share you the results. So we have about 75% of you who are going to be receiving or planning on getting the vaccine. About 4% or one of you doesn't want to, and about 21% are unsure. They maybe are going to be receiving it, maybe not. They want to wait some more. Okay, so that's good. That's good information. Okay, all right. So for VMRC, what we did really is to contact the local county public health offices, because all through this vaccine effort, it channels down through the local county public health offices. So that's how the vaccine efforts go. That's the channel. Okay, there. So for Amador County, at the beginning of what I did was really I contacted them about December 15, around that time, asking them how VMRC can help, specifically with our long-term care facilities. Amador County were interested in the names of the facilities, so we gave them the names of the facility and the information of the administrator. There were no names of consumers that were given, so again, no information of the consumer was given to the county, just the name of the administrator and the name of the care home. They directly notified these vendors for scheduling, and they also notified a couple of our staff to schedule vaccination. So that's how they got vaccinated in Amador County. In Calaveras County, they referred us to that pharmacy partnership program that I was telling you with CVS and Walgreens. With San Joaquin County, the same thing. We sent names of vendors, and then they gave us an appointment flyer on the 8th of January. And so some of our staff has been vaccinated at that day. Some have scheduled at a later date. And then we continually advocated for our vendors who serve our consumers. And so eventually, care home providers, family caregivers, SLS, ILS were given a slot to set appointment on the 11th of January. And then the latest we got was a link to vaccine sites, because at first, up to the 11th, they had limited vaccine sites at San Joaquin County. So eventually after that, they were able to increase their capacity. They were able to get Safeway to be a vaccine provider. And so we had those names to be, and links, link given to our staff so they can share that with our vendors and those family caregivers so they can schedule appointments. So with San Joaquin County, they want you to schedule your own appointment for vaccine clinic. For Stanislaus County, the same thing. We coordinated with them mid-December, and then they wanted information of our staff and program vendors sent to them. So with them, they wanted a list in the beginning, so we gave that information to them. On the 11th, VMRC staff and some vendor programs were able to get vaccinated through the Stanislaus County Public Health. And then early this week, actually, this is supposed to be last week, the other vendors were accepted by Stanislaus County. They are all under phase 1A tier 2, which I will explain these phases to you later. And then eventually they weren't asking for a list anymore. They're like, just send them all here. So that was really great. Right now, I've asked them when they will resume their vaccination because of that news that they're on hold. So I'm waiting a response from them. For Tuolumne County, the same thing. We contacted them mid-December. They were given the names of the care home and the name of the SLS vendor, the company. They have vaccinated about 20 providers in December, and then it continued to contact other vendors directly and setting an appointments. And we had another vaccine schedule last week. And so they had vaccinations that way in Tuolumne County. Other efforts are with ARCA, the Association of Regional Center Agencies, clinical directors. So this means these are the group of the clinical directors from all 21 regional centers. So we were meeting several meetings regarding the consent on how do we make sure that we're giving appropriate consent for our consumers when we're the ones doing that, especially with those pharmacy partnership program. I know DDS and ARCA were also working closely with California Department of Public Health, or CDPH, advocating for our consumers that are not living in long-term care facilities so that they would be included in the 1B, phase 1B of vaccination instead of 1C. Also, the Department of Social Service have given the names of the care homes, ICFs, and long-term care facilities to the CVS Walgreens Pharmacy Partnership Program. This is really good when DSS made that, because initially the CVS Walgreens Pharmacy Partnership Program was only by registration, which ended in November. A lot of our vendors were not able to register. So it's awesome that they did that. So now the vendors are registered, and they just need to coordinate with their community care licensing liaison who they need to get a hold of if it's CVS or Walgreens. and then they will vaccinate you. So the CVS pharmacy partnership, the pharmacy staff will go to the care home and give the vaccine to the consumers and to the staff. And they can do that. They'll set up 3 different dates to do that, going to the care home. So that's really nice. So we're talking about the vaccine. We said that it is an mRNA vaccine. So how does this vaccine work? So this mRNA is a component of the virus, and it has the information so that our body will make that spike protein that the virus has. So that spike protein is this spikes here. This is the COVID, this is the SARS-CoV-2 virus, and it has this spike protein. Coronavirus family all has this spike protein. And that's why they're called coronavirus, because this spike protein looks like a crown, corona for crown. So that's why they're called coronavirus. So once this mRNA go into our human cell, it will simulate our cell to make and convert that mRNA to a spike protein, this one, inside our cell. Eventually, that cell will release this spike protein in our bloodstream. Our body will recognize that, hey, this is a foreign object. I don't know this. And they will call upon our immune cells to attach to this foreign body and then make antibodies against it. So these Y things here, the green ones, are the antibodies, so that our body could be protected. So that's why you see this human being here has all these antibodies and has a shield, because he or she is now protected, and because it is in the memory of these antibodies. And so if ever it comes a time that you get infected with COVID, you have that protection. So instead of getting very, very sick from COVID-19 and maybe die from COVID-19, you won't experience that anymore if you have the vaccine. So other things in the news related to that, we talked about that new strain that have been coming up. And even before that B117 strain came up, there was already a study in the New England Journal of Medicine about a different strain. They're trying to see if the vaccine will be effective to that other strain. So it was showing in this study that, yeah, the vaccine will still be effective against that other strain of the virus. And so this is just a sample. When you get vaccinated, you're given this card. So I want to make sure that you guys know, when you get vaccinated, you should receive this card. It has your name, your date of birth, what type of vaccine you got, when did you get it, where did you get it, and the lot number. I mentioned the lot number a while ago, so they will write it down there. Some write it down, some have a sticker on it, so it just depends. But those information will be in this vaccination card. At the back of that, it will also have an information when you will come back for your second vaccine shot. For your second shot, you need this card, so don't lose this card. And then this is just the document where they gave that V-Safe tracker. Okay, so these are nice visuals. I wanted to refer you to this link here on top. If you want to see what our state is doing, this Community Vaccine Advisory Committee, they are the ones discussing and talking on who gets to be on those phases that we have discussed. And I got this slide from their presentation. So how do we get the vaccine? What is the process, right? So first, they try to find providers. They are called vaccine providers. There's a huge, long process on that one, that they have to fill out those paperworks. Once those are done, it will be reviewed by the California Department of Public Health, or CDPH, once it's approved, they will now allocate or they will order vaccine for you, for that provider, for that vaccine provider. Once the order is approved, it will be processed by CDPH. And then it will go, of course, to either Moderna or Pfizer. They will ship it with regards to whatever temperature it needs. They will ship it to which state it went to, whatever order it was. And then they will receive the vaccine. Usually it's the LHJ, Local Health Jurisdiction, or that's another name for the local county public health offices. They will receive the vaccine, they will store the vaccine according to its proper storage, and then administer the vaccine. So that's how you get the vaccines. It's the process. I wanted to emphasize this link here. This Community Vaccine Advisory Committee of California have meetings, and they discuss all these things about vaccination process. These are their next meetings. It's online. You can watch it. But the question, if you have questions, they won't get it live. You have to send it to them in this email address ahead of time so that they can get it. That's how you get a public comment or ask them a question, is to send that question through here in this COVID-19 vaccine outreach at cdph.ca.gov. These are other updates with regards to vaccine. It's not just Moderna and Pfizer who's doing the vaccine. We also have Novavax, and they are on the 23rd of December. They underwent their phase 3 trial of the COVID-19 vaccine. So that's good. They're enrolling adult volunteers now. On the 30th of December, the UK authorized AstraZeneca and University of Oxford vaccine for emergency use authorization. This vaccine is not yet approved here in the United States. They are still reviewing this. They're thinking, the latest that I've heard is most likely about a few more weeks before they probably approve that. They're also reviewing the vaccine from Johnson & Johnson. This is kind of like a general overview of how that process of allocation works. First, the vaccine companies submit their clinical trials to FDA, the Food and Drug Administration, for emergency use authorization. Once they get that EUA approval, the CDC Advisory Committee on Immunization Practices, or ACIP, meets. They usually meet like the day after FDA released approval to discuss how safe that vaccine is. They review it. They're kind of like the outside review committee. And then they also help with the vaccine allocation. And then for the state of California, the Community Vaccine Advisory Committee further decides, together with the California Department of Public Health, how that vaccines will be allocated, and then they give those information to the local county public health offices. So this phase 1, 2, and 3, remember we're talking about phase 1 a while ago. This draft of phases are here. It was in November of 2020. So this draft has changed. I don't think we're talking of phase 4 anymore. It's now more on 1, 2, and 3. But right now, they are focused more on phase 1, and the phase 1, they have divided into phase 1A, 1B, and 1C. 1A, we've talked about being the healthcare personnel or long-term care facility residents and staff. Last 22nd of December, remember we talked about ACIP. CDC ACIP, they gave further guidance on who should be on phase 1B. Because remember, in this slide, 1B was only for essential workers, but then CDC ACIP added the 75 years and older in this non-healthcare frontline essential workers. But remember, I'm trying to give you guys the date because this changes. At this point in time, at that time in December, CDC ACIP was recommending that individuals 65 and older were phase 1C. But as we all know, that changed last week because for California, they have included 65 years and older for phase 1A. So for California, they released in the 5th further subdivision of phase 1A. They divided it into tier 1, tier 2, and tier 3. So the links here, that is where you can see a copy of this document that I kind of like did a screenshot. Tier 1 are the healthcare workers, acute care, meaning they're in the hospitals, skilled nursing facilities, vulnerable individuals, paramedics, dialysis center. Tier 2, they have intermediate care facilities, home health care and in-home supportive services, community health workers, public health field staff, primary care clinics. This is just another, I guess, visual of the different phases of phase 1, 1A, 1B, 1C. So in here, it's showing you that 1B, they've divided into tier 1 and tier 2. And then 1A will have the other tiers here, 1, 2, 3 that I've mentioned a while ago. And this is just another visual of that. I highlighted here community health workers because that's really where most of our community vendors, VMRC vendors fell under that community health workers because they go out in the community, they work, support our consumers in their homes so that they'll be able to live independently. So that's why they're considered in here, the community health workers. And this is just that tier 3. This one is from the Department of Defense. They have a different definition, but I really just want to emphasize that at that time they're looking at now instead of phase 4, phase 3, wherein it will eventually be available in the public, similar to what routine vaccination programs are. So for our VMRC consumers and family members, there was this DDS letter that has been released last week. And this is the link if you want to see that full DDS letter with the letterhead of DDS. So this one, DDS is saying that family members are like healthcare workers. And in that, if these are members of those who care for people with cerebral palsy, Down syndrome, epilepsy, or those with specialized healthcare needs, including dependence upon ventilators, oxygen, and other technology, then they could be eligible under the phase 1A of the state vaccination plan. So that is what this letter is all about. And then DDS has also given this frequently asked questions document. And again, this is the link to that. I just took a screenshot. It's like, I think, 5 or 6 pages. I focus on this question here, who with VMRC, I usually get this question, who can give consent for regional center consumers? And this is similar to how we does the consent process at VMRC. If the adult regional center consumer is at that stage where they can understand and make their own decision, then definitely it should be the person himself or herself. There could be other people that are circle of support who can help the consumer, like family member or other people that they trust to help them make the decision, and that is called supported decision making. But of course, the ultimate choice would be the consumer. So in that instances where the consumer can give their own consent and make their own decision, we want them to do their own decision and give their own consent with regards to the vaccine. Now, for those that are minor children, it's their parents or legal guardians. For those that have authorized durable power of attorney for healthcare, then they will be the one. We have some adults who are conserved and have conservators, then it will be the conservator to make the medical decision making. They will be the one giving consent. Now, as mentioned here in this last bullet, in limited circumstances, a regional center executive director or designee, when the consumer does not have the capacity to consent and there is not another person authorized to make decisions. So that's when the regional center steps in. COVID testing. We are still doing testing. I just wanted to share this. It's part of our public health service to our community. Last Friday, we did one in Modesto. Tomorrow, we're going to do another one in Modesto, and this is the link. And this is also found in our website. This is our website where you can find it in the health advisory. Last Friday, there's a link on how to register for that one. It's a drive-through, like this one, drive-through COVID testing. It's through oropharyngeal, so we chose that so that it's not too painful for our consumers. On the 27th, we're going to have another one in Stockton. Other people who wanted kits to be done at their home, this one, the Pixel by LabCorp, is an FDA-approved home test kit. This is the link that you can order, or you can search it online, Pixel by LabCorp COVID-19 testing. You order online, it's for 18 years old and older. They send it to your home. You get it, it's nasal, just at the tip of your nose like this, nasal swab. And then you put back the sample. They have a return sticker there. You call FedEx, you ship it back to them, and they give you the result in usually about a day after they receive the test kit. Again, this is for 18 years old and older. The other FDA-approved testing kit is this LMA home test kit for 2 years and older. This one is a 20-minute test. When I've read it, it said it's going to be available in pharmacies, though I haven't personally seen one in the pharmacy. And you don't need a doctor order. On the Pixel, you don't need it either. So other than that, even if you get the vaccine, a reminder I want to remind everyone is you still need to wear a mask. You still need to do safe distancing, 6 feet. And you still need to wash your hands for 20 seconds. If there's no soap and water, use hand sanitizer that's alcohol-based, and avoid gatherings or crowds so that we will prevent the spread and transmission of the virus. Because remember, you could still be an asymptomatic infected person and carrier of the virus even if you got vaccinated already. Take care of yourself, continue to eat healthy, exercise, meditate, or do mindfulness techniques or deep breathing. And just remember that we are all still in this together, and you got to take care of yourself. And so that's it for me. I added here some of the other references that I have used so that if you guys are curious, you guys can click them and use them. We're going to open this now for question and answer portion. And there are some people who have sent me an email, so I wanted to address this. One question was, are parents of VMRC consumers able to get the COVID vaccine if they are not IHSS employees. So as I've mentioned a while ago, if you are in this, wait, how am I going to go back? There you go. The way for parents of VMRC consumers to get the vaccine, if you are a family caregiver, what did I do? I think my, oops, sorry. I think my Zoom, I lost my, so let me go share a different screen here. Here. Let's go through this one. It will be if you are a family caregiver, where we have that letter from DDS. This one. So if you're a family member caring for somebody who has cerebral palsy, Down syndrome, epilepsy, or specialized healthcare needs, including dependence on ventilator, oxygen, and other technology. The way I understood is those people who are medically involved or medically fragile, they are the ones who are the family members that are considered healthcare workers. So if that is the case, then you may receive the vaccine if you belong in this group. And then going back to the other question, will documentation be provided to families as proof of being a caregiver to get the vaccine? So one documentation would be that DDS letter that I have shown you. You can download that in this website. And then you can also ask your service coordinators to give you a letter saying that you are a family caregiver of a VMRC consumer. So that's one way of doing that with regards to this documentation. Okay, so after that, I'm gonna go, Vicky, do we have other questions?
We have two, and I'm not sure if they were answered because we received them kind of early on, but the first one is, you mentioned previous dose of mRNA vaccine. I thought that this was the first vaccine of this type. That's the first part of his question, of her question. And the second part is, if you are vaccinated, would you still shed the virus?
Okay, so the first part is yes. I think that's referring to the CDC guidance on allergy, saying that if they have a previous dose of the mRNA vaccine, and they have given that because, remember, healthcare workers have received this mRNA vaccine already. So they are the first ones that have received it already, and some of them have had those allergic reactions that triggered the CDC to update their guidance on this. So they are referring to those that have received the first dose of the vaccine already, because I don't know how many millions now Americans who have received it so far, primarily those healthcare workers. So that's pertaining to that. And if you have received the first dose and then you had severe allergic reaction, then you shouldn't get the second dose. And then I forgot the second part of the question.
If you are vaccinated, would you still shed the virus?
Oh, okay. So the vaccine does not have the virus. If you get infected and you are an asymptomatic carrier, then you will shed the virus and spread it to others. So that's why we are asking people to still continue wearing masks and physical distancing and do the other health precautions, safety precautions, even after you have gotten the vaccine. Because yes, it is still possible if you're in that window of being infectious without you knowing it. Yeah.
And I think this next question was answered, but when will caregivers of VMRC clients be eligible for getting the vaccine?
Yeah, so as of now, most of our counties are considering that family caregiver as to what I have described a while ago that fits that DDS letter. and especially if you are caring for someone who is medically involved. For San Joaquin County, they want you to register to that link and bring a proof of or a letter. So you can ask that from your service coordinator. I know last week when I talked to Stanislaus County, they were not asking for a letter, but I did get feedback from a couple of our staff who are saying Stanislaus County is asking for a letter. So to be safe, because I clarified that with Stanislaus County, but I just haven't received any answer yet. So just to be safe, try to contact your service coordinator and ask for that COVID letter as well.
And she also has a second question. What if the clients have other issues such as autism?
So they did not specifically include autism in that letter. I'm thinking their reason is because they are focusing really as a healthcare provider, those that are medically involved, a lot of healthcare issues. So if it isn't autism, but then you have other healthcare issues, and like there are some people who have autism and fragile eggs and then other healthcare issues, then that would qualify. But if it's autism and very healthy, then I don't think that would qualify.
And the last one I have is, my son cannot wear a mask. Is there a place I can take him to be given the vaccine? And I'm not sure what county this is for.
Usually the counties does, and so for San Joaquin County, they have the link. But for now, so wait, sorry, let me backtrack. She is referring to the consumer.
The consumer cannot wear a mask.
Yeah, the consumer right now, BMRC consumers, as of this time that I'm speaking, it could change tomorrow, hopefully. Right now, the only way consumers can be vaccinated is through if they live in that long-term care facility through the pharmacy partnership program. So the long-term care facilities has that pharmacy partnership program. They go to the facility and they give vaccine to the consumers and the staff. Those consumers in the community, if you are 65 years and older, as of now in California, you can get the vaccine as well. I just have to warn you that even though the governor has given a go signal to give vaccines to that group, it doesn't mean that all local county public health offices across California are giving it. The local county public health office get to decide when they will start giving vaccine to those groups. The reason being there are counties that have not received vaccine allocation for that group. So they won't be able to give because they don't have vaccines. So it's good to check with your local county public health.
Okay. And then there's a few comments. A follow-up on that autism question was, she was asking for 5 regional center clients about if they have autism, but I think you addressed that.
Okay.
And then if our family member with Down syndrome and or autism has already had COVID, should they still be vaccinated?
That's a good question. I want to make sure that people understand that having had COVID before is not a contraindication to getting the vaccine, meaning you still have to be vaccinated. We are still highly encouraging you to get the vaccine. The reason is because being sick with COVID-19, even if it gives you that immunity, your body mounts up in antibodies against the virus, based on what they are studying right now, it's only up to 90 days. And there are even some studies that are saying it's not reaching 90 days, it's less than 90 days. So the vaccine will give you longer and stronger immunity against COVID-19. There have been initial studies actually right now that are saying Moderna vaccine may last up to 2 years. So that's one of the new things that we're hearing right now. So hopefully it does, hopefully it lasts longer than that. We don't know yet how it will be, if this is something we would need a booster shot soon, or is this something that is like, is this going to be like a chicken pox wherein after you've gotten your few shots, you're good all your life? We don't know yet. So those are things that they are still studying up to now. But yes, definitely, if you've had COVID-19, please still get vaccinated.
And we have, if our family member with Down syndrome and or autism has a heart condition, would the vaccine harm them in any way?
So they have studied those in the trial, some that have had lung disease. I know they have studied those that have high blood pressure. I don't know specifically if they have studied what type of heart problem or specific heart problems, if they have any volunteers that belong to that. So with regards to this is one good example that you should discuss it with your primary care provider, discuss this health condition and other medical history, if it is something that will be good for the individual to get the vaccine.
And the last one I have is, when will the consumers get the vaccine?
We don't know yet. I know they were included in that phase 1C. Most of the counties right now are in phase 1A still, tier 2. I know they have included 65 years and older for California, which before was in phase 1B. So, and there were advocacies up to state level that are trying their best to include our consumers living in the community in their homes to phase 1B instead of 1C. So I haven't heard anything new yet. Once we know more, we will definitely update you guys.
And that's it. The last one was from Dina saying, thank you, Claire. Really appreciate all this info. Great job.
Thank you. Thank you, Vicky, also for all your help. Thank you, everyone. Looking at the chat now. Thank you, and you're welcome, Antonia and Lisa and Dina. And thank you all so much for attending. We will be posting a recording of this webinar soon. If you need the link immediately, email me. I can send you a link. Usually, Zoom will give it to me in about 10 minutes or so. It just takes time for us to post it on the website though. But yeah, so if you need it immediately, just let me know. I can send you a link to the recording and also the PowerPoint. My email address is clazaro@vmrc.net. So if you guys need anything, you can email me there. I really appreciate you guys for being proactive in trying to learn more about the vaccine. This is one step to you deciding and getting that informed decision if this is right for you. We are highly recommending this, but definitely look at it on a case-by-case basis by consulting with your primary care providers if you have a lot of medical conditions. So I guess that's it for me. Thank you all so much, and you guys have a wonderful day. Bye, guys.